Basic wound care. This video will show the basic steps of wound care. First, if the wound is still actively bleeding, apply direct pressure until it stops. Ask the patient about the injury, how it happened, and when. Remove clothing near the wound. If the wound is on a limb, check pulses, sensation, and capillary refill. Examine the wound and tell the patient what you are going to do. Then gather your supplies. To anesthetize the wound, you need local anesthetic and a syringe with needle. To clean the wound, have a large syringe, an 18-gauge needle, and clean water. Your sterile equipment includes suture, needle holder, forceps, scissors, and a drape. Dressing materials include gauze squares and gauze bandage. Use gloves and eye protection to protect yourself from exposure to blood. First, anesthetize the wound. You cannot clean wounds adequately if the patient is in pain. Using a 5 to 10 milliliter syringe, inject the anesthetic inside the edge of the wound into the surrounding tissue. After a moment, test if the edges of the wound are numb. Next, clean the skin around the wound. Then, irrigate the wound with plenty of clean water. Don't use antiseptics within the wound. They can slow healing. Thoroughly flush the wound with a large syringe. Lift any flaps to flush underneath. Next, use a needle on the syringe. You can break the sharp end off for added safety. This focused irrigation provides the pressure required to clean the wound well. If the wound looks dirty despite irrigation, use a piece of gauze to clean out the wound. Wounds can also be washed under running water. Decide whether to suture a wound based on its condition. Close simple wounds that are clean, the tissue looks healthy, and there are no signs of infection. Most clean wounds can be closed within 24 hours. Cover the wound with a gauze pad held in place with a bandage. Then check capillary refill, pulse, and sensation. Give a tetanus vaccine if the patient is not up to date. Teach the patient about home care. A stretchy wrap on a leg or arm wound will reduce swelling. Advise the patient to elevate the limb above the level of his heart. These measures reduce swelling and decrease the risk of wound infection. Tell the patient about the signs of infection. If he has increasing redness around the wound, pus, a bad odor, or there is swelling, he needs to seek care right away. Have him return in 5 to 10 days for removal of the sutures. Remember, anesthetize the wound Clean it well. Then close the wound and dress it.